And then there's finals week starts from the 8th to the 14th, and the final exam for this course is scheduled for the 14th. And I will give you all day, as usual, to take the test. The time limit on it is 2 hours, and it will cover all the topics from the beginning of the semester till the end. Okay, anything else before we start? Don't forget to sign chat. I can see there are a number of participants who haven't signed chat yet, so please do so.
Professor?
Yeah?
Is it GCCCD or GCCD?
3 C's.
3 C's, okay, thank you.
Okay, we're ready to start the presentations. The first one on the list is Rachel Henriksen. Rachel, are you ready?
Yeah, I just have to.
Okay, share your screen.
Is it doing anything? Oh, I have to click share. Sorry.
Yeah, that's a requirement.
Sorry, I had to open my system preferences. Hello? Sorry, it just kicked me out. Oh wait, it's showing up now. I'm sorry.
Now we see, I thought I
The
saw your slides, but now it just shows Zoom.
this, does that work?
That says your name,
Okay.
cystic fibrosis, and your mutation.
All right, cool. So I did my presentation on the N1303K mutation. The effect that this has on the protein structure is that basically it's a missense mutation, which means that it causes a single nucleotide change, and that codes for an entirely different amino acid, which further causes a different tertiary structure. So then it either has decreased probability of working, or it doesn't work at all. And the effect this has on the protein function is that it has gating abnormalities, so it doesn't process chloride as it should. And this is a picture of how it normally looks, like a normal CFTR protein. And this is what my mutation does to it, so it doesn't process the chloride as it shows in the picture. And it also it reduces the production of ATP, and because it causes a different amino acid to be produced, like the slide before, the tertiary structure is changed, causing it to be folded wrong. So that's why it doesn't, that's why the chloride channels don't work. And because of that, it can't get to the cell surface. And yeah, chloride channels don't work, and that's why the mutation causes elevated sweat chloride levels in the patients who have it. And disease symptoms caused by this is that people that have it, their lung function can go down to 24%, and this depends on like how old the people are, and then race and ethnicity also play into it, but I didn't put that in here just because it was too much to write. And then 95% of patients that have the N1303K mutation are pancreatic insufficient, and they also have a high chance of getting this infection. I tried to look up how it was pronounced. I think it's just Pseudomonas,
Pseudomonas. Yeah.
Pseudomonas, and it's from like it's found in water, the bacteria in water and soil, and they're just really sensitive to it, and it can cause a lot of issues with them because they're immune compromised, because usually it wouldn't affect like people who aren't immune compromised, but it's really dangerous for them. And the possible treatments are very few. I didn't find anything that actually like treats the disease. They kind of just treat the symptoms. So they take oral pancreatic enzymes every day to help them process the nutrients and vitamins in the food that they eat, because as I said before, 95% of them are pancreatic insufficient, so they can't process the enzymes in the food. So those supplements help them, but these supplements don't prevent them from developing CF or developing it further. And from what I found, there's no further treatment options. And I also found out that most people who have this mutation also have another mutation, and like having this mutation is kind of rare. And there's only barely 2,000 people with this variant. And yeah, that's all I have. Thank you.
Okay, good. Thank you, Rachel. Next, we go to Julian Sabri.
All right, I'm ready.
Okay, share your screen.
All right. Can you see it?
Yeah,
All right, perfect.
you also have N1303K. Julian, are you there?
All right, I'm ready. Are you ready?
Yeah, go ahead.
Sorry. All right, so I did the cystic fibrosis variant N1303K. Basically, with the structure of this mutant, it's a single base change, and it changes a C base to a G base. What this does to the protein is that it's created, but it does misfold. So because of that, it doesn't allow it to move to the cell surface. And the way to correct this is you can use correctors such as Lumacaftor or Tezacaftor to help defective CFTR fold correctly. Symptoms of this mutant are a few things. So 95% of patients experience pancreatic insufficiency. People with this mutant usually have about 47 to 117% lung function. And 53% experience Pseudomonas infection. And with the pancreatic insufficiency, there does come a lot of side effects. I wouldn't say side effects, but like a lot of symptoms. So the treatment of these symptoms can be this prescription drug called Trikafta. It's used for people over 12 and up. They haven't made one for younger patients yet. But what it does basically is it adds Alexicaftor, Tezacaftor, and Ivacaftor, and it targets that protein to get rid of the defects. However, it does have a lot of possible side effects, so there is a lot of different types of testing you have to go through to get it. And if you do end up having to take it, you do have to get your blood tested every month, and it gets sent to that doctor's office that prescribed you this medicine, so that they can constantly see like your levels and such. Thank you.
Okay. Thank you, Julian. Okay, next is Sadie Leash. Is Sadie here today? I don't see her. So if she shows up later, we'll work her in later. And in the meantime, go on to Nathan Huzar.
Can you see it?
Yeah,
Okay. So for my cystic fibrosis project, I chose the mutant F508del. F508del is the most common CF mutation and is primarily considered a processing mutation. The effect of the mutation is that it removes a single amino acid from the CFTR protein. Without this building block, the CFTR protein cannot stay in the correct 3D shape. The cell usually recognizes that the protein isn't in the correct shape and disposes of it. In the CFTR2 database, there are 65,000 people who carry this mutation, and I found out that F508del is more prominent in Caucasian populations. And this is just side information, but I figured out like what everything in the F508del means. The F means phenylalanine. The 508 means the number 508 in the amino acid sequence, and del means that it gets deleted. And here you can see the 508 getting deleted because of the mutation. The class I mutation is in class 2. What class 2 is supposed to do is to fold the protein correctly so it can move up to the cell surface. But because of the mutation, it instead misfolds, preventing it from moving to the surface. Some of the symptoms for the mutant is that there's 93 pancreatic insufficiency, 24 through 125% lung function, 59% pseudomonas, and 100 milliequivalent per liter of sweat chloride. And lastly, the treatment that you can use for this mutant is Orkambi or Lumacaftor. And the effect that this treatment is supposed to do is improve the CFTR protein, improve the folding of the CFTR protein so that the CFTR protein can reach the cell surface. And that's it.
okay, thank you, Nathan. I think next on the list is Santa Zaya, but I think she's not presenting today. So next would be Violet Lincoln. Violet, can you hear me? I think Violet is here. She's showing up on my screen, but I'm not hearing anything. Violet, are you there? Okay, you're here. Can you unmute yourself and share your screen? Violet, I think your microphone is off. Can you turn it on? And so we can hear you and then share your screen. Okay, I see Violet sent a message saying that she's having a technical difficulty. So we'll wait a couple minutes to see if she can sort that out.
Meanwhile, Professor, did you receive my email?
I'll
We're on agenda.
check right now and see if I received your email.
Okay.
Yes, I received it. Let's see if I can open it. Yeah. Yeah, I have it. And let's see. Yeah, and I can advance your slides. Okay, so when it's your turn, we'll do it that way. I'll share my screen.
Okay.
In the meantime, Violet, how are you doing? All right, well, while you're working out your device problems, we'll go to the next on the list and we'll come back to Violet later. The next presenter is Fabian Pliego. Fabian is apparently not here, so next after him is Jose Jacques. Apparently Jose is not here. About Georgie Willis.
Yes, I'm here. I'll share my screen right now.
Okay,
Okay. Can you see it?
yeah.
Okay, let me. So the mutation that I chose is the F508del mutation, and it's the most common mutation, and it's considered to be the processing mutation, and it's class 2. The F508del removes a single amino acid from the CFTR protein, and then without the building block, the CFTR protein is unable to stay in the 3D shape because it's missing that piece. So then the cell cannot recognize the protein, and then it gets rid of that whole strand. This then causes problems because it's in the second mutation, so it cannot be considered the processing mutation in those cases. And the missense mutations occur when the change in the DNA letters cause an incorrect amino acid to be incorporated into the CFTR protein. This then leads to a decrease in the quantity of the protein in the cells, or the defective processing, and or a decrease in the function of the protein, a defective gating or conduction. Pancreatic insufficiency is the biggest disease symptom for this specific mutation, because pancreatic insufficiency is when the pancreas cannot make enough of one specific enzyme. So when that piece is removed, it primarily causes this symptom. This makes it hard to digest food and secrete other things in the pancreas and small intestine. CFTR also causes a dysfunction of the salt and water balance, so it can cause severe dehydration of the secretions and excessive loss in salt and sweat. Hold on, I think I skipped one. Oh, no. If both parents are carriers, then a child has a 25% risk of inheriting 2 of the mutated copies of this specific CFTR gene. And 1 in 35 Americans are carriers of CFTR genes, even though they may be unaware. And the most common people who get this strand of cystic fibrosis are babies, and it's usually 1 in 3,000 newborns. How to be screened for cystic fibrosis? Usually it's picked up in infants, And the sweat test is one way that someone might be able to catch cystic fibrosis from a young age, because the sweat test measures the amount of chloride, a part of salt in sweat that is used to diagnose cystic fibrosis. And people with CF have a high level of chloride in their sweat. Treatments, the best treatment that I found for this specific mutation is the lumicafactor or ivacafactor or combi, because it works and enables the CFTR protein with the F508del mutation, and this allows for it to fold in a more correct shape that is able to activate the protein to allow more chloride to pass through. Even though that this drug isn't a perfect fix, it definitely would help the mutated CFTR protein to move around some chloride, and the movement of the chloride would reduce the symptoms of cystic fibrosis and allowing everything to work. Okay, that's it.
That's it?
Mm-hmm.
Okay, thank you. Next on the list is Ann Jarin. Is Ann here? I don't see her listed, so Erica Arara.
Hi, I'm here. Let me share my screen. Can you see that?
Yes.
Okay. Okay, so my name's Erica, and I chose the S549N variant to talk about. So first, what is cystic fibrosis? It is caused by two mutations in the CFTR gene with one mutation in each copy. CFTR proteins are found in the lungs, pancreas, and sweat glands. Mutations in a specific gene are responsible for cystic fibrosis. And with the proteins that don't work correctly, chloride ions cannot flow freely in or out of the cells, leading to an imbalance of salt and water. Without salt and water outside of the cell, thick mucus builds up throughout the body. So for the S549 defect, it is a class 3 gating mutation, which means that the CFTR proteins reach the cell surface and they're created, but they're not able to function. The channels in the proteins are at the cell surface, but they don't open as often as they should, so not enough chloride ions can move through the channels as well as salt and water. This picture here is, you can see how there's the channels isn't clearly open, so not enough chloride ions and water is able to move freely through. And I found that 64% of patients on the CFTR2 site are infected with this variant, and the average age is 18. Next, the symptoms of this variant is impaired lung infection, and then if this variant is combined with another variant that causes pancreatic insufficiency, then pancreatic insufficiency can also be caused by this variant. And on the site, 85% of patients that are pancreatic insufficient for both variants, it's 85%, if that makes sense. And so for pancreatic insufficiency, a treatment for that is taking pancreatic replacement enzymes, which are supplements that replace the enzymes, but that their body does not make. And these enzymes help the body absorb the nutrients and vitamins they eat. And then a treatment for this variant is Caldeco or I can't say it. Invacador, I don't know. And it's the leading treatment. Caldeco is a prescription medicine used for cystic fibrosis in patients 4 months or older. And it allows the channels to stay open, allowing chloride ions and water to pass through. It's found to be 10% effective, but it is not specifically a cure for cystic fibrosis. And I found that the clinical benefits for what is it called? Kalydeco is that it improves the pulmonary function and reduces the rate of pulmonary exacerbations. And it improves glucose tolerance, sustains weight, and has better growth for children. That's all.
Okay, good, Erica. And now we're at Veronica Munoz. So I will call up my email and share my screen, and you should be able to see Veronica's slides. Veronica, can you see that?
Yes.
Okay, I'm trying to make it bigger, but I don't see how to do it because it's stuck in my email.
It says start slideshow at the top.
Okay. Yeah, that did work. Okay, go ahead.
It's not in a slideshow form yet. We can't see it like that.
Okay, can you see it like that?
What does it look like to you, sir?
It just shows your title slide, CFTR cystic fibrosis, mutant S549N. Can you see that?
Yes, but it's still on the email.
Yeah, I don't know how to get it. Oh, wait. I'm trying to download it, see if that will allow me to show it better.
I think it's on the bottom left tab. It says her name. So you should open that.
Bottom left tab. I don't see that, but let me see if I can get it another way. Do you see that?
No.
Okay.
Just try pressing start slideshow and see what it does.
Well, I did.
Okay. On the bottom, is your screen fully, is it on full screen? Because I saw her name on the bottom tab on the left. It says downloaded.
Okay, I think what I have to do is stop sharing and start again. So I'm going to stop. Now, can you see that?
Yes, we can see it.
Okay, that's a slideshow. Can you see that?
Yes, I'll go ahead and start.
Okay.
Hi everyone, my name is Veronica Munoz, and I did the chosen mutant S549N, cystic fibrosis. Next. If we can skip to the next one, Professor.
Oh, okay. I have to do the advance.
Please, thank you. So the effects of cystic fibrosis are, this is an overview. Cystic fibrosis disease is caused by mutations or changes in the CFTR gene. This gene provides the code that tells the body how to make the cystic fibrosis transmembrane conductance regulator protein, and it is also inherited. This will result in either no CFTR being made or malformed, thus inhibiting the flow of salt and fluids through the airways, leading to buildup of abnormally sticky mucus that can damage many of the body's organs. We can proceed. I think you went forward to, yeah. Effect on protein mutation. The mutation S549 mutation, known as the amino acid serine 549 position asparagine, is a class 3 mutation. In this class, the CFTR protein is created and moves to the cell surface, but the channel gate does not open properly, also known as the gating mutation. There are only 6% of people with this CF who have at least one mutation in this class of all people. And you see here that the mitochondria or the Golgi apparatus doesn't go through the gating, through the gate here. Next, Professor. Disease symptoms. The effect on patients with S549 asparagine variant has sweat-clotted symptoms is 184 people. Number of patients who have pseudomonas is 60 people with this variant. And lung function with this variant by age is 10 to 20 is 116% to 34. And that's 39 patients. Percentage of patients with CFTR2 with variant S549 who are pancreatics insufficient is a total of 94 patients, which is 82% of all CFTR2 with variant S549. Next, Professor. Treatments on mutation S549N. Patients with this variant will have to take oral pancreatic enzyme supplements daily. This prescription helps the person's body absorb the nutrients and vitamins contained in the food they eat. This medication will not prevent the patient from developing cystic fibrosis. And the medication is called Kalydeco. It's a potentiator indicated for the treatment of cystic fibrosis in patients of 4 months or older who have one mutation in the CFTR gene that is responsive to this medication Kalydeco or ivacaftor. And that's it.
Okay. So I will.
And the next is the credits.
Okay. All right. I just escaped from the slideshow. So let me. And I stopped sharing my screen. Thank you, Veronica. Next is Shad Kaikayi.
Okay, I'm going to share my screen right now. Can you all see that?
Yes.
So hi everyone, my name is Shahad and I did my presentation on F508del cystic fibrosis mutation. So the effect of this mutation on CFTR on protein structure and function is that this mutation changes the CFTR structure by deleting deleting amino acids from its structure. This mutation also alters the CFTR's 3D shape, making it unrecognizable to cells. These changes prevent CFTR from transporting the CFTR resulting from this mutation lacks the correct structure that cells recognize. So the cells destroyed, leaving CFTR, leaving them with no transporters for the essential chlorides and salts needed by the cell. Okay, diseases, symptoms, and possible treatments. The primary symptoms of F508del is mucus built up in the body, making it hard to breathe and digest and absorb food. The possible treatment is trifecta, which is prescribed to treat this mutation in some countries, such as Canada and some European countries. And also this mutation can be treated with, I guess I'm pronouncing it right, Symdeko, in patients ages 6 years and above. And Symdeko is a combination of dazagifator and Evacator. And the other treatment is Orkambi, which enables this mutation to adapt a more correct shape, improving its conduction capacity. And this drug, it combines Magavitor and Evacator and improves the protein's ability to move chloride ions. And the last one is, I'm not really sure how to pronounce it, but Kalydeco, which is also used as a CFTR modulator. And then conclusion on F508del cystic fibrosis is that it hampers this, F508del hampers the smooth and quick improvement of chloride through CFTR. Drugs and physical therapy helps treat the symptoms of this mutation, but there is no cure. This mutation is genetical and shortens one's lifespan to an average of 37 years. And I also found out that certain ethnic groups such as Caucasians and Hispanics are more prone to cystic fibrosis. That's it. Thank you.
Shahad, I missed the significance of the hand in one of your slides.
Done. Can you all still see?
Yeah, I can still see it. I was just curious, why did you show a hand?
Oh, sorry. I guess this is someone with this mutation. This is what happens when they have this disease.
Ah, okay.
Yeah.
All right, I hadn't seen that before. Okay, thank you. And let's move on to Justin Mosa.
Hello, can you hear me?
Yeah.
All right, perfect. I'll share my screen. Can you see it?
Yeah.
All right, perfect. Sorry, I don't know how to present this.
On the right side.
Oh, sorry, it was covering by, it was covered. All right, can you guys see that?
It's loading. Oh, there it is.
Earth conclusion. How's that? Okay, can you guys see everything?
Yeah.
Yeah. So I did my cystic fibrosis presentation on the genetic variant G551D. And here's something about the mutation. This variation will cause cystic fibrosis when combined with another variant that also causes it. And it also will cause pancreatic insufficiency when in combination with another causes pancreatic insufficiency. So it requires another variant to actually start affecting it. Oh, my bad, sorry about that. There's about 2,900 patients that have this variant of cystic fibrosis, which is actually the third most. The other percents are about over 20%. The other one are about 88%. So this is the third class, and it's the third most common one, with about 3% of people with cystic fibrosis having this certain mutation. And lung function with patients carrying this variant ranges from anywhere to 42% to 118%. The effect on the mutation would affect the protein structure by replacing a base or deleting it. Sorry about that. Of the DNA strand, which would cause basically a ripple-like effect, which changes the base pairs in the proteins later on. And the variant G551D is class 3. So in this class, the mutation affects how the ATP binds to the binding sites. And also the protein can reach the surface of the cell, but its channel becomes non-functional because it's being prevented from opening properly due to cystic fibrosis. The disease symptoms and possible treatments. One symptom of G551D variant would be decrease in lung function efficiency. Also, a higher sweat chloride concentration leads to patients having pancreatic insufficiency. Treatment that could be possible, that has been really popular actually for people with this mutation, is the drug Evacaftor. I can't really say that. Which improves the lung function, sweat chloride concentrations, and reduces pulmonary exacerbations in cystic fibrosis patients over a 48-week period. So about 4-year period. Another treatment that could be used is pancreatic enzyme replacement therapy, or PERT for short, which replaces the enzymes in your body in the digestive system that your body cannot produce when you have cystic fibrosis. And here's the conclusion. The variant of cystic fibrosis is not the most common, but affects thousands of people every day. About 94% of people who suffer from this genetic mutation also have some sort of pancreatic insufficiency that prevent them from normally producing digestive enzymes. New technology and drugs are being produced year by year to try to combat this dangerous disease as known. Thank you.
Okay, that's it. All right, Justin, we'll go on to Isabel Veliz.
Okay, let me share my screen. Okay, can you see it?
Yeah.
Okay. Okay, so hi, my name is Isabel, and I chose the N1303K mutation. Just an overview, cystic fibrosis is a hereditary disease which is caused by mutations in the cystic fibrosis transmembrane conductance regulator, or the CFTR gene. It affects the lungs and digestive system, which is due to the production of a thick, sticky mucus that can clog the lungs and pancreas. CFTR is a chloride channel that is responsible for regulating the balance between salt and water across epithelial cells. And here you can see the healthy lungs that have a clear airway, whereas the lungs affected by cystic fibrosis have an airway that is lined with thickened mucus. The N1303K mutation is a common and severe mutation. It is a missense mutation which is located in the nucleotide binding domain 2, or the NBD2. The effect of the mutation is the processing and transporting of the CFTR protein, which also alters the tertiary structure. And this is considered a class 2 mutation, which is where the CFTR protein is created, but a misfold prevents it from reaching the cell surface. And the result of this defect is the degradation of CFTR, which is where the protein just decays or reduces. And here these are the different classes, and N1303K is a class 2 where there's no traffic. So the protein is produced, but it is unable to reach the cell surface. And symptoms and treatments can vary and are different for each person that is affected by cystic fibrosis. There are 3 main systems that are affected, which are the respiratory, digestive, and reproductive system. Due to the production of the thick mucus, it affects many organs within these systems. So for the respiratory system, it is the lungs that are being affected. And this can cause frequent respiratory infections, which entail a chronic cough and even coughing up blood, as well as breathing problems. And ultimately, it can sometimes lead to a collapsed lung. And for the digestive system, it is mainly the pancreas that is being affected. And symptoms can include malnutrition, which also includes weight loss and poor growth. And that is due to the decrease of production of a pancreatic enzyme, which helps digest and break down food, so they aren't receiving a healthy amount of nutrients needed. The gastrointestinal tract is also affected, which includes abdominal pains and abnormalities in their stool due to bowel disturbances. For the reproductive system, both women and men are affected, and there are fertility rates that are being affected, which is due to the buildup of the thick mucus. There are treatments that can help with the lung problems, like physical therapies and exercises, which can help loosen the mucus and make it easier to breathe. There are also prescriptions and medicines that can help thin the mucus, and antibiotics are often used to help fight the frequent infections, and anti-inflammatories that can help with the inflammation as well. And for the digestive problems, a healthy diet high in calories often helps with malnutrition and weight loss, as well as supplements that help with the pancreatic enzymes and vitamins that are being lost. And they also have treatments that can help with intestinal blockages that can help with constipation and bowel disturbances. And that is all. Thank you.
Okay. Thank you, Isabel. Now, let's go back to Violet Lincoln. Violet, have you been able to project your slides? Violet, are you there? Violet says she's trying. I think your mic is unmuted, so if you talk, we should be able to hear you.
Professor, can you hear me?
Yeah.
Okay. So I'm actually logged in on my phone and on my computer. My phone is so that you can hear me, but on my computer I have my presentation.
Okay. Should coordinate.
I don't know why, but my computer is not allowing me to like speak through it for some reason. So
that's why we couldn't hear you. Okay.
yeah. Let me share my screen. Okay.
All right, we can see that.
All right. Everyone can see it? We're good?
Yeah.
Okay. So I did my cystic fibrosis presentation on the mutation R553X. So within normal proteins, the cells receive instructions from the CFTR gene to produce them, and the proteins are made and then sent to the cell surface to act as channels between inside and outside of the cell for water and particles to go through. It creates like a healthy balance of salt and water through the cells found in the lungs, pancreas, and sweat glands. However, genes have errors, and these errors are also called mutations, which can affect the amount that salt and water are transported between the different cells. So this mutation is also known as a nonsense mutation because it never actually is synthesized. So the RNA is actually unstable, and so therefore it doesn't actually make it past the RNA. There are therapies aimed to help fix the RNA or just providing normal RNA directly to the cell that can actually bypass this mutation, but around sorry about that, around 22% of those with CF have at least one mutation like this, which is connected with another mutation that causes the CF disease. The sweat glands that are affected, the symptoms, well, it can be tested through, the sweat chloride measurement is a test used to help diagnose CF. Generally, the higher the patient's sweat chloride is, the more likely the patient is going to have CF. Here's a little demonstration of how the normal sweat duct works, the sweat gland, and then a cystic fibrosis sweat duct. As it's all clogged and you can't go in and out of there, so therefore there's an imbalance of salt and water. Adults who don't have CF almost always have a sweat chloride measurement of less than 60. And then we move on to the pancreatic insufficiency, which is going to be like a thick, sticky mucus blocks the pancreatic and bile ducts. These enzymes that are being blocked normally help the body to absorb nutrients and vitamins, but when they're blocked, it can't do that. And then we move on to the lung function. With the lung function, there's, for this mutation specifically, from people who are less than 10, like in age less than 10, their lung function is 67% to 128%, and there's about 76 of those patients. From 10 to 20, it's drops even lower to 43%, all the way to 118. And as we see up here, the normal lung function is going to be around 80 to 120, and so people over the age of 20 are actually have the chance of their lung function dropping down to 23% here to not even a full 100, and there's about 325 of those. The test that they do, it measures the amount of air that a person blows out in the first second when they take a breath, and that's how they test the lung function. Sorry, excuse me. And then the Pseudomonas infection rate with just the variant who's infected is around 58%. There's 394 of these patients. However, with patients with 2 CF causing variants, there's a lot more. Of those patients, give me 34,000, and around 55% of them. So it is not a lot of damage by itself, but when with another person or with another variant, it creates a lot more damage. And then I just have some summary information. There's almost 1,300 patients with this variant in the database that I was looking at, and causes large pancreatic insufficiency, this mutation does. And that's pretty much all I have.
Okay, thank you. Now, there are still people who have not presented, and I'm wondering if any of you are now present. So, Sadie Leash, Fabian Pliego, Jose Jacques, and Jaron. And from last time, Hussein Aljiber, Isabella Estrada, Jonathan Garcia, or Ernesto Del Valle. None of those people are present. Okay. Well, I would like to, first of all, thank you all for your presentations and congratulate you for doing a good job in each case. You proceeded to put together your presentations with very little instruction for me on how to do it. So you used your own ingenuity. And I think from the way you presented that, that you learned something more about cystic fibrosis by putting together a presentation than you would have if you had just sat and listened to me talk about it. So again, thank you all. The period isn't quite up yet. Scott, are you there? Yeah, Scott's still here. Will you be giving your workshop at 2? Scott must have stepped away. I'd encourage you to check in with Scott for his workshop at 2 and be prepared to ask him questions about materials for the upcoming tests. Test 4, a week from today, and then the final exam 2 weeks from today. Do any of you have any comments or questions? In this case, especially about the presentation of information about cystic fibrosis. Any thoughts about how this process could be improved?
I just want to know if I could just present my paper so I can focus on studying.
Say that again.
I just want to know if I can present right now so I can just focus on studying after.
You want to present now?
Yeah.
Sure. Did I miss you? You're not on the list? Oh, I apologize. And yes, please proceed to present now.
Okay. Can you guys hear me good? Can you hear me good, Professor?
You're very faint. I can barely hear you. Could you say it again?
Can you hear me better now?
Yeah, I can hear you.
Okay. So my name is Ingrid, and I picked the F508 del, which is found in chromosome 7. And what is cystic fibrosis? It's a progressive genetic disease that causes persistent lung infections, limits the ability to breathe over time. Cystic fibrosis is an inherited disease known by buildup of thick, sticky mucus that can damage many of the body organs. Progressive damage to the respiratory system and chronic digestive system problem. Here you can see a healthy human lungs. Here inside the bronchioles, where cilia, it's a normal thin layer of mucus, gets the germs and dust that we breathe. Right here, cilia move side to side with a thin layer of mucus catching germs and dust. Here, this is the cilia clearing out the waste, clearing out the pipes. This is a normal process. And as you can see here, this is cystic fibrosis. It's a thicker, stickier mucus that prevents the cilia from moving back and forth and clearing the airways. CF prevents CFTR chloride ions from moving across the cell membranes. Cystic fibrosis causes a buildup of harmful bacteria, leading to experience acute, like coughing, mucus production, or shortness of breath. Long-term damage occurs to the lungs with bacteria causes infections and inflammations. So the F508del mutation is a class 2 mutation, includes the F08del for which the mutant protein is translated in its entirety, but fails to fold properly inside the cell. The F508del mutation removes a single amino acid, phenylalanine, from the CFTR protein at position 508. Without this building block, the CFTR protein cannot stay in the corrected shape, 3D shape. The resulting abnormal channel protein breaks down shortly after so it never reaches the cell membrane to transport chloride ions. Here, the autosomal recessive means 2 copies of an abnormal gene must be present in order for the disease trait to develop. How is cystic fibrosis detected? A simple test checks if you have high levels of chlorine in your sweat. The sweat test is the standard test for diagnosing cystic fibrosis. What are the symptoms? Very salty testing skin, persistent coughing at times with phlegm, frequent lung infections including pneumonia and bronchitis, wheezing or shortness of breath, poor growth or weight gain despite a good appetite, frequent greasy, bulky stools, or difficult with bowel movement, and male infertility. Life expectancy between 44 and 47 years of age. It's the #1 life-threatening recessive genetic trait among whites. The F508del mutation is found in 70% of CF alleles, Caucasian population. 1 in 3,500 whites, 1 in 9,300 Hispanics, and 1 in 15,000 Blacks. The treatments such as nebulized medications, antibiotics, non-invasive positive pressure ventilation, Trikafta, Orkambi, and chest physiotherapy. Currently, there's no cure for CF, but researchers are working towards one. Just a fun fact, I guess, Trikafta will cost $311,000 annually, or $23,000 per 28-day pack, according to the Securities and Exchange Commission. And that's it. Thank you.
Okay, thank you, Ingrid. And again, I apologize for leaving you off the list. Is there anyone else that I missed who would like to present now? No? Okay, well, let me check. Scott, are you back yet?
Yes, sir.
Okay, are you having your workshop at 2?
Yes, sir.
Okay, I announced earlier that you might be able to help students review for the upcoming tests.
It's a possibility.
Okay, I'm sure you're ready for that.
Yes, sir.
Okay, I will have a test ready for you for next Monday. Again, you can log in anytime during the day to take that test. And in the meantime, if you have anything that you'd like to consult with me about, you can send me a message, or you can talk to Scott.
Professor,
Yeah.
do you think there might be a study guide for the last exam?
For the last exam. The one coming up, you mean on Monday?
Yes.
I will put something together and try to get it out to you within the next couple of days, so you'll have time to react to it.
Okay, appreciate it.
Okay, anything else? All right, well, that's it for today then. Scott's on at 2, and you'll hear again from me next Monday.
I hope you had a great Thanksgiving.
I did, and same for you, and I hope we all have good Christmas holidays too.
I hope so too.
Vaccine is coming.
And so is Christmas.
Yeah. Probably not coming for us this year, but by this time next year, we should all be immune. Okay, unless there's something else, I'm going to end the session and end the meeting for all.